Hello, good afternoon. I'm Dr. Vikas Singhal, a Senior Consultant, Department of GI and Bariatric Surgery at Medanta Medicity Hospital in Gurgaon. So today I would like to discuss what surgery is best for incisional hernia. So first of all, I would like to, like for everybody to understand what is an incisional hernia. So incisional hernia means surgery or a hernia after an incision, when some incision or some surgery has already been performed. This is one of the most common types of hernia that we see. Any surgery that happens in the abdomen area, on the tummy area, we find that because we have cut the normal skin and muscles, when they join back together, there is a risk of forming a hernia in the future. So we see a lot of patients where some surgery has been performed. They may include any surgery such as previously for any trauma, any gynae surgery, surgery for childbirth such as cesarean section, gynae surgery such as uterus removal, or any surgery in the past on the tummy area for liver, pancreas, intestines, where some intestines were damaged or there was previously a cancer that had to be removed. So all these surgeries in the future have almost a 10 to 20% chance of forming a hernia, because we have cut the normal tissue and we have put it back together. So, why does hernia form in one person and not in another person? So there is a lot of reasons for this. Sometimes the tissue quality is not good. Some patients may have had a lot of injury, previous wound infections. So all of these can lead to an increased risk of hernia formation in the future. So if an incisional hernia forms, how do we deal with it? And what type of surgery is the best to treat the incisional hernia? First of all, it is important to understand that, patients ask me that, is surgery the only option for a hernia? So yes, surgery is the only option, because a hernia means it is a damage in the muscles. जैसे कि if I explain simply to you in Hindi, it would mean जैसे कि अगर कोई कपड़ा फट गया तो उसको हमें सिलना ही पड़ेगा. That would be the only way to repair it. So if a cloth is torn, we have to stitch it back together. We have to stitch it and we have to reinforce it. If the quality of the cloth is not good, then we have to put reinforcing. That is what we say a mesh. A mesh is sort of a reinforcement for the normal tissues, or the muscle. If the muscles are weak, if the quality of the tissues is not good, then we need to put a mesh so that the tissues can grow over the mesh, so that it would provide a strength for the repair, or in the hernia surgery. So the hernia after this surgery does not form again. So going to talk about what type of surgery is best for incisional hernia, whether it is laparoscopic or keyhole, or whether it is open surgery, again going through the previous cut usually. So this would depend on several things, such as what is the size of the incisional hernia, how big is the gap in the muscles, how big is the sac of the incisional hernia. The sac means the content that is coming out into the gap. Sometimes there may be just a little bit of fat from inside. Sometimes there may be intestines that have come and have got stuck inside the hernia. So sometimes the hernia may be really big with a lot of loose skin, and we find that when we have to do the surgery for the hernia, we have to remove all the extra skin and not just repair the hernia, but do a good cosmetic result also by removing all the loose skin and tissues. So the surgery for the hernia would depend on several of these factors. When a patient comes to me, I have to see what is the patient's age, what is the patient's fitness level, what are their comorbidities meaning whether they have diabetes, blood pressure, heart disease, what would be the safest repair of this hernia, that not just safe, that would also be durable, so that the hernia does not come back again. So several factors have to be taken into account for this. Typically, if it is a small hernia or a medium-sized hernia, maybe up to 5 to 6 centimeters gap where the skin is not very loose, then we would prefer a laparoscopic repair or a keyhole repair, where we make small cuts and we reduce the contents of the hernia, and we put a mesh from the inside or within the layers of the abdominal muscles to give it strength. If the hernia becomes very big, typically more than 6-7 centimeters in size, that is the gap in the diameter of the hernia, or a lot of intestines, or the sac is very big, a lot of content is coming into the hernia, then laparoscopic repair may not be ideal. It may be better to do an open repair, where we go through the previous cut, reduce all the hernia back inside, put the muscles back together, and also put a mesh or a patch over which the tissues can grow and get strength from it, so that over 3 to 6 months they become quite strong. Sometimes the hernia is extremely large, especially as being a tertiary referral center. We get complicated hernias referred to us from other hospitals who've already undergone 2 or 3 previous hernia surgeries, sometimes with mesh, and the repair has not been successful. They have already failed 2 previous mesh repairs sometimes. So in these kind of very complicated hernias, then we have to look at several factors. We have to optimize for the surgery. We have to see that whatever we can do best so that this hernia will never come back again. This may include measures such as weight loss before the surgery. It may include nutritional improvement by a high protein diet, guided diet supplements, so that this time when we operate, we may need to also do a component separation, so that the muscle closure is not very tight. If it's very tight, then with pressure it can split apart. So we may need to do a release of the muscles, what is called a component separation. There are specialized techniques for this, for abdominal wall reconstruction. Anterior component separation, posterior component separation, transversus abdominis muscle release. All these are medical jargon terms, but these are measures, advanced techniques that we may need to implement, so that we form and we do the best possible repair for this incisional hernia, so that the hernia can be done, surgery can be done safely and with durability, so that hopefully there will be an extremely low risk of recurrence or the hernia coming back in the future again. So to summarize, I would like to say that when somebody is planning surgery for an incisional hernia, it is not a very simple way, simple answer that whether surgery will be done laparoscopically or open, whether it will be with mesh or without mesh, what will be the hospitalization. So because this has to be individualized to the person, so we can minimize any risk and maximize the benefits, so that this hernia hopefully will have minimum recurrence or never come back again. So please, go ahead, seek medical care, get a consultation to see what is the best form of best surgery for your individual case, as several factors need to be assessed for this. I wish you all the best. Thank you.